All right, welcome back. I've got one of my good and long-term friends. He's a doctor of physical therapy, and this is Sabir, and we've got Sabir on his lunch break. So, just a little bit of background is we actually started Jiujitsu right around the same time, and so we've known each other now for over 10 years,
Yeah.
um, and done a lot of mat time together. He is one of the most impressive and confusing people you will ever train with because he makes you think while you're being tapped out, and you wonder how did that happen, and then he does it again, and he does it again. So um, let's get started. What I want for today, since Sabir has so much insight, he's an athlete. He is very much into the holistic approach. I want to get from you, Sabir, what are the mistakes that people make when they go to physical therapy or when they go to rehab, when they've had an injury? What are the mistakes that you see people making, particularly for folks that want to get back to their sport or back to their activities?
I think a big one that is frequently I usually talk about like my first visit with someone is getting someone's expectations to be reasonable, you know? Like and then like expectations on like either tissue healing or like the science behind pain, if something is an acute injury, if it's chronic, like how long will you have to be off the mats for or off the court for? What does the phase of in between rehab going back to performance look like? Um, and then that's that to me that's like the biggest one. Because if you're coming in with something that's a very chronic issue, then there might be more layers to peel back, and the healing time might be a little bit longer. If something is very, I guess, simple and acute, it could be like devastating. But if it's acute, you're going to have a very clear timeline on what you think the possible progressions are going to be to return to play. Also, this expectation will change depending on your age, your underlying health, and just kind of where you are in life. Like allostatic load, or are you super busy at work? Are you always traveling? Versus are you a professional athlete and you have everything at your fingertips? Or are you a professional athlete or a very good athlete, but if you're financially like not as advantageous as other people, it's going to be maybe a little bit harder also.
Okay. Okay. So what I'm hearing and what my experience has been with folks is people are just really eager to get back to uh, return to play, and they can rush it. What I tend to see is people will then re-injure themselves, or they won't allow for that tissue to actually go through healing appropriately the first time.
Yeah.
So then, what do the conversations look like? Because I rarely tell someone ever to stop what they're doing. I think actually stopping your sport with that is could be detrimental. I would much rather see someone modify their activities while they are healing rather than completely stop. So what does that conversation tend to look like?
It depends on the degree of the injury, right? If someone totally tears their ACL and the knee is swollen and they want to go back to practice, but they're going to modify it, I'm like, no, you need to like relax. Like you need certain prerequisites to even do some of the modifications. But if you have like a grade 1, 2 sprain of something, you might be able to get back to the mat or the court or the field a little bit earlier, but you're still going to have certain prerequisites that you need to fulfill your like tasks well. Um, the other thing with the modifications, like it's good because it keeps people, I think, from like an emotional standpoint, it keeps them very sane. Like if not sane, but like if you're like addicted, not addicted, if you really like your activity, you're gonna
Yeah.
always want to do it, whether it's like a source of like stress relief, expression, and then once that's kind of curbed, if you don't have any other like secondary way of expressing that, you're gonna feel depleted, and it's gonna be like your pacifier got taken away from you. You're gonna start emotionally crying or whatever, you know. So the modifications are great for that. Sometimes the tissue just needs to heal. Sometimes that tissue capacity is lowered, and the only thing
Yeah.
that's going to make that tissue capacity better, because the body is adaptable, is time, is gradual loading and exposure. But you want to make sure you do it in a way that is suitable for that tissue, right? Well, you know more than anyone that like a highly vascularized tissue will heal better, faster, and probably with better quality than something that's avascular, right?
Right.
Like
Right.
hyaline cartilage, any kind of fibrocartilage, a meniscus, a labrum, those things are going to take a long time. A ligament will take a long time to heal, depending on the degree of injury. So it's definitely respecting that window of time, because what I tell people is like, if you don't allow this window of healing to happen, you're just not going to have it. You can try to get it back with either like PRP or a stem cell, but the original window of time is no longer there. You want to make sure you don't
Uh-huh.
squander that window. Um, Usually, if people are like, "No, man, I really got to get back to the mat. No, man, I got to play ball," and then it's another story where I'm like, "Okay, so you do understand this could happen, but you also need to do this. Okay, fine. Let's kind of meet you where you're at, and then we just kind of progress from there." But it changes depending on the person. That's why I think having someone's expectations and their knowledge around something, and then their education on what could or could not happen depending on those outcomes, is important.
Yeah. Yeah. And setting the expectations, the goals that the person has. I mean, someone who's in season and has an injury but needs to play
Mm-hmm.
is very different than someone who is more recreational
Yeah.
or just has an activity or maybe has like an event coming up in the future. Um, those are different scenarios, and then you can look at them as an individual and help them with their particular goals. And then, another question I have, because I know you well, we've had so many different conversations and we've worked together off and on over the years. What is it that sets you apart from other cookie cutter type physical therapists? And what I want you to address is what's the appropriate kind of interaction and relationship that someone should have with their physical therapist when they need help with rehab and recovery.
I'm gonna answer the first part because I kind of just like forgot the second part you said.
Okay.
I was like, oh my god, so many words. Um, the first part, what sets me apart? I don't think I'm like this. Whoa, he's so different. I really don't think so. I also have a lot of sympathy for the cookie
Mm,
cutter thing. I also see like the pros and cons of it, right? Like, let's say you go to someone, they give you like this general exercise thing for, I don't know, let's say you have a knee sprain or you have some sort of knee injury, and someone gives you a like general and global exercise program. Like sometimes, like the research says, like sometimes people just get better, you know? So from one standpoint, it's like, why would I do something else? You know,
okay.
if they're gonna get better with this simplified plan, and if this simplified plan has worked for so many years and it makes 80 to 90% of my patients better, why
It's
not
a
do
good place
that?
to start then.
You
Okay.
know, yeah, it's not that. So, the other thing is that a lot of therapists just don't have the time and the
Mm,
energy in their day to make something super custom for every single patient. It's like it's like a shepherd and their flock. It's like if every sheep had, it's a very like biblical like analogy, but like if every sheep had like their own little thing, like this shepherd is not going to be able to like go as far or graze as much. He might be able to do that for like a smaller group of sheep. But if I have
Okay.
a caseload that's like 200 people, 300, you know what I mean? It's like you got to
Yeah.
keep eyes on everything. So that's one thing. The other thing, so what sets me apart? Oh, okay. I don't know. I just think I'm like, if I'm being completely honest, I'm just like, I'm very curious. I'm like kind of unhappy with my performance like all the time. So I'm like, oh, let's make that better. Like, oh, this could have been quicker. Or like, ooh, that expectation was like blah, blah, blah. Like I could have been 3 minutes quicker with this, or I should have taken longer with that. That's why I feel like that's what maybe sets me apart a little bit. I'm just deeply unhappy with my performances on certain
I think looking back, I think you're hard on yourself. If I could give you feedback, you have always been curious, and I
yeah,
think that is something that is very important because you keep searching and you keep learning. You're a lifelong learner, and
yeah,
and I think you've known that for quite some time, and so now you're pouring your interest and your curiosity, into this field as you continue to train. I've seen your body transform. I've seen you overcome injuries. And so yeah, I
yeah.
appreciate quite a bit of that. Hey, so how are we doing on time? Are
Oh, I'm fine.
you're
I'm fine.
okay?
Yeah,
All right. Well,
yeah.
let's
The other question what was the other part of the question?
um I asked you about what sets you apart, and then, what's the appropriate
Oh, yes.
interactions that people should
Got it.
have?
Um, Appropriate interactions. I'm assuming it's like what would be a good interaction with a PT?
Yeah,
Like
so
like you
so
want
so so where this is coming from is sometimes when I refer someone out to physical therapy and I see them back in a couple weeks or a month and I ask them how was it, and they go, "Oh, well, and I can tell that they're not happy with it. And so I want people to know, like, what is it that they want to be looking for? What is the interaction that would be the most appropriate for them in order to help them heal
right.
and to get towards their goals?
There has to be some mutual agreement on a goal or a desired outcome. And then both people have to be on the same page. And typically the therapist should be like there should be like a champion for them. Like you want to be able to push a person enough to like physiologically and biologically advance certain performances or tissue capacities or like pain modulation or whatever. But then you also need a patient that's willing to be patient with a certain process. And I think like having clear communication between both parties is really important. Anytime any of my friends have like needed to go to PT,
Yeah.
I always tell them, I'm like, you need to make sure that like you're advocating for yourself. If you're not happy with something, just say that. You know,
Hmm.
hey, like where's your mind at going with this? Like, why did you give me this? I don't see how this connects with what I'm working. And then oh yeah, well, like, oh, I have a problem going downstairs. Well, why am I doing a bridge? I'm on my back. Well, listen, like your knee can't take it right now, so we're trying to like unload it, but still strengthen something else. And then once that gets, oh, okay, I get that. You know,
Hmm.
is understanding the process. I think something else that's really important for patients to have is, I think having some sort of something objective that can describe progress is important. Whether it's like repetitions of or a number of stairs able to climb, like ascend and descend with or without pain or whatever. So there's a number, and then there's pain, which is subjective. And then there's like, oh, but let's say I don't have pain. Okay. I just can't run a mile. I feel like I get tired. Fine. Let's look at like pacing. Let's look at mile time. Let's look at cadence. Can you improve those things over time? It's like, oh, I feel like my calf is weak, or okay, how many calf raises can you do for whatever? It's like you know what I mean. Something that's like
Yeah.
measurable, but still
Yeah.
is related to the goal and being on the same page of the patient and the therapist.
Okay. Yeah, and I think that's where for some people, the communication probably breaks down if
Yeah.
they feel like they're not being looked at as
Yeah.
a person, rather they're just someone that's kind of coming through this rehab machine, um,
Right.
and without getting any sort of individualized attention or their concerns addressed.
Yeah, and the other thing is like sometimes when a therapist has been in for like a long time, like there's like patterns that you'll see. So sometimes that pattern recognition will be like, oh, okay, that's what this shape looks like. I'm gonna address it like this, and they'll be fine, right?
Okay. Okay.
And that could be fine. But if the patient needs something different, that communication has to be like met with the therapist.
Yes.
You know,
Yes.
like even though you're entering a machine, like it's still a human to human interaction. You can still be
Yeah.
like, whoa, let's pump the brakes for a second. I need this from my health professional. Can you help me with that? I had a guy. He was like, listen, I'm before I go on, I need you to know I've been fucked over by the medical system so much. I was like, all right, I just met you, okay. And he's like, I need you to be on the same page as me. I was like, okay. So I need your goal to be my goal. I was like, yes, yes, Dad. What do you want? And he's like, I want to live another good 50 years. I was like, okay. How old are you now? He's like, I'm 63. I'm like, great, yes, let's do it. We will be the oldest person in the world. We can do it.
Oh, that's funny.
But like I think he felt heard. I like hooked him up with this longevity professor that I know, and I was able to give him resources. Am I going to be able to attain that goal? I have no idea if I can actually attain the elixir of life, but I'm going to try, and this person knows I'm trying.
Yes. Yeah. And like you said, you guys are now on the same page. Your goals are aligned with each other. And
Yeah.
so, you're kind of moving towards that goal. So
Yeah.
that also means that you need to live for five
Yes.
or six more decades.
Exactly.
Hey, so let's finish with this. I'm going to name a sport, and I want you to tell me the top two injuries that come to your mind with that sport.
Okay.
Okay. So let's start off with volleyball.
Volleyball? Mm, like, can I just say like a body part and then the injury, or like an actual specific diagnosis?
Body part and injury.
I'm gonna say like labral tear,
Okay.
shoulder, and
Shoulder,
then
labral tear,
maybe like meniscus aggravation or
knee, and
meniscus. Yeah,
meniscus.
yeah, knee and
Okay.
meniscus. I'm just gonna say
All right.
we could look at like a meta-analysis and actually see the actual, but we're just going off of my. Got
Yeah,
it. Okay,
just yeah. What kind? Okay. So that was volleyball. Surfing.
surfing. I'm gonna say shoulder and neck, either a rotator cuff strain or tear, and then maybe like some like facet dysfunction or concussion. Maybe, yeah. Anyways,
Interesting. Okay.
yeah.
All right. Concussion. I didn't wouldn't have thought about that one. But I could see that. Jiu-jitsu.
Besides everything, I'm gonna say injuries. I want to say like neck and shoulder.
Hmm. Okay.
Oh, I'm saying neck and shoulder.
Neck
Probably
and shoulder.
the hard one. I'm trying to think about me off of how I had like every
Because
single injury.
there's a lot,
Yeah,
right? I
there
mean,
is a lot.
neck, shoulder, knees, low back,
I'm
elbows.
I'm actually curious as to what the actual numbers are. But anyways, that's what I would say. I could be
Okay.
wrong.
And then last one, let's go with uh, triathletes, triathlon.
Probably knee and hip.
What aspect of the hip?
Um, Probably like a labral tear or something like that. That's what I would guess. Knee and hip.
And then for the knee, what is it that you
I just think a lot of these like repetitive like loading. These people are like athletes before. They probably have these chronic injuries. Like I'm gonna say meniscus again. Like again, I keep kind of boiling it down to like these like slightly avascular structures that just have
yes,
a
that
lot
are
of
yes.
repetition and loading.
Yeah. And
Yeah.
once they're injured, it's hard for it to. That's where I come in with the regenerative techniques. So that totally makes sense.
Yeah.
All right, Sabir, dude, that was good. It's good to see you. I miss
Same.
you, buddy. I
Same,
miss you,
man.
man.
Yeah. I got
Yeah,
to come back down and hang out.
yeah, yeah. So thank you. You have a good rest of your week. We will do this again. Okay.
Cool, man. Yeah.
All right, man. You take care.
See ya.
Bye bye.